America's healthcare hellscape, a comedy of errors. America, the land of the free, home of the brave, and, possessor of a healthcare system that makes you want to fake your own death to avoid medical bills. Seriously, it's a Kafkaesque nightmare out there. You've got skyrocketing costs, insurance companies that are basically evil villains in a superhero movie, and a level of complexity that would make a Rubik's Cube weep. It's enough to make you want to pack your bags and move to, well, pretty much any other developed country. Because, here's the thing, the United States is the only wealthy nation without some form of universal healthcare. That's right, we're the outlier, the weirdo who shows up to the party in a clown suit when everyone else is in cocktail attire. And the worst part? It doesn't even have to be this way. There are plenty of countries that have figured out how to provide quality, affordable healthcare to all their citizens. Let's take a trip across the pond, shall we? First stop, Canada, the land of maple syrup and, surprisingly, functional healthcare. They've got a single-payer system, which means the government foots the bill for medically necessary services. Sure, there are some wait times, but at least you're not going bankrupt while you wait. Next up, the United Kingdom, where they've got the National Health Service, or NHS. It's publicly funded and provides free healthcare to everyone. Sure, it's not perfect, but at least you can get a doctor's appointment without having to remortgage your house. Finally, let's hop over to Germany, where they've got a multi-payer system with universal coverage. It's a bit more complicated than Canada or the UK, but it works. They've got high-quality care, low costs, and everyone's covered. See, it's not rocket surgery, or maybe it is, in which case it's covered. There are plenty of ways to do universal healthcare right. Now I know what you're thinking. John, this all sounds great, but how are we going to pay for it? Good news, folks. There are a few ways to fund universal healthcare. We could implement a special tax like they do in Canada. Or, we could slightly increase existing taxes, similar to the UK's system. Another option is to reallocate funds from other areas, like our bloated military budget. Just saying. And don't forget about those lovely corporations. They could contribute more, especially considering they often benefit from a healthier workforce. It's time for them to pay their fair share, don't you think? Section 4, cheaper by the dozen cost savings with universal healthcare. But here's the kicker. Universal healthcare might actually save us money in the long run. Think about it. We'd eliminate the massive administrative costs associated with private insurance. We could negotiate lower drug prices with pharmaceutical companies. And crucially, we'd be investing in preventative care, which is way cheaper than treating preventable diseases later on. It's basic economics, really. By pooling our resources and providing healthcare to everyone, we can actually bring down the overall cost. It's like buying in bulk, but instead of toilet paper, it's life-saving medical treatment. Section 5, everybody wins except insurance CEOs. Benefits for all. So, to recap, universal healthcare would save us money, simplify a ridiculously complex system, and, oh yeah, save lives. That's right, folks. By providing everyone with access to quality care, we'd be improving public health and reducing preventable deaths. And it's not just good for patients. Doctors and nurses would benefit from reduced administrative burdens and increased job security. Imagine that, healthcare professionals who can actually focus on, providing healthcare. Universal healthcare is a win-win for everyone, except maybe for those insurance CEOs who are currently swimming in pools of your hard-earned money. But hey, I'm sure they'll find something else to do with their time. Maybe they can take up knitting, or learn to juggle chainsaws. Whatever floats their boats, as long as it doesn't involve denying people life-saving medical treatment. So, there you have it, America. Universal healthcare. It's not just a good idea, it's a moral imperative. It's time we joined the rest of the civilized world and made healthcare a right, not a privilege. Now, if you'll excuse me, I need to go find a Canadian to hug.